of compensation. Okay, I'll give you some practical examples. So, what is happening? For example, this is the respiratory acidosis. Respiratory acidosis is in initial stages. As I said, acidosis, the pH is going to be down because 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 if it is going to be respiratory, so of course the CO2b is going to be higher, and the bicarbonate component is going to be lower. I mean, it's not unaffected. So that is what is the uncompensated phase. Because of lack of response from the kidney yet to acidosis, so the bicarbonate will remain normal. However, so what is that is where comes the partial compensation. Partial compensation is going to be, for example, respiratory acidosis. What did I say? So the pH is going to be acidotic. But when you look at the carbon dioxide component, carbon dioxide, of course, is going to be increased. However, and in response to that, because it is trying to compensate, so that is why bicarbonate will also increase further, in fact. So, what is the responses? Because in the compensation, as I had already mentioned, kidney is starting to respond to the acidosis by increasing the amount of circulating bicarbonate. Okay, and what is the fully compensated? So the fully compensated one, what is going to happen is, in fact, the pH is going to become normal. PaCO2 is still going to be elevated, and the bicarbonate is also going to be elevated. So during passage of time, so it takes time a little bit when this is going to happen, of course. Yeah. In the last stage, as I said it, so the pH is going to become normal, but because it was corrected, so that's why due to the compensation mechanism it has happened. So the PaCO2 and the bicarbonate is going to be higher. So similarly, what is happening in respiratory alkalosis? So as I said, it respiratory, it is alkalosis. So pH is going to be higher, PaCO2b is going to be lower, bicarbonate is not going to be affected in the uncompensated. So the kidney is still going to be recruited, in fact. And the partial compensation, what is going to happen is bicarbonates will start getting decreased. When the bicarbonate is going to start decreasing, so that is the partial compensation, and they continue to decrease further so much up to when the pH becomes normal. Then it means is fully compensated. So if you understood that, so this is the reverse of that. So this is what is called as a metabolic acidosis and metabolic alkalosis. So metabolic acidosis, what happens is in the uncompensated one or the normal one, the pH will be less. PaCO2 may be normal, of course, without getting affected, but the bicarbonate is going to be lower. So this will be the uncompensated. So the lungs, there is not yet any response from them, in fact. So that is why once they will be recruited, they will start to decrease the amount of circulating carbon dioxide. So in the partial compensated stage. However, in the fully compensated stage, the pH will also become normal and the PCO2 or bicarbonate are going to be lower values. So the fourth stage, what is going to be is the metabolic alkalosis. So metabolic alkalosis is in the uncompensated stage. Anyone would like to take a chance to explain this? Any of the students? So what is happening over here? Pankaj, try.
Sir. pH is increasing, that's why it's alkalosis,
Wonderful.
and HCO3 is increases. That means it's a metabolic alkalosis.
So how much is the
And
normal? How much
PSCO2
is the normal value of bicarbonate?
is 22 to 28, sir.
Wonderful. Okay, so in the partial compensated,
Partial compensated, sir, pH is increased,
hmm.
and that means it's alkalosis still.
Hmm.
HCO3 is also increased. That means it's a metabolic alkalosis. In response to the alkalosis, the lung responded and causes the PaCO2 to increase, uh, so that
Yes, that's the way. Wonderful, wonderful. So now what is happening in the last stage?
in fully compensated it is normal pH,
Hmm.
and the pH is normal, so that's why it's compensated fully,
Hmm.
and the PCO2 and HCO3 is
So
increases.
what was happening in the metabolic? So this becomes the last stage when the partial compensation starts. Partial compensation, how it starts is the PCO2. When the next ABG you will be doing, so you will notice the PaCO2 is going to rise. However, when you did, for example, again after a few hours, you did the ABG again. So what is going to happen is you'll be surprised in the same patient. Oh my gosh, the bicarbonate, which was higher, okay, it is still high, but PCA2 also has become higher, but the pH has become normal. So that is what is the stage of full compensation, in fact. Yeah. So
Okay.
the pH. So in the initial stage, the counterpart is the key to look out for. For example, if it was metabolic acidosis in alkalosis, in which you were trying to look at the bicarb, you have to look at the PaCO2. And if you are able to look on that, and later on, if you see the normalization of the pH, bingo, you are done. Okay, seeing solving problems is one of the really, really important things, especially in this. So, we are trying to give you some examples. Try to think about this clinical case scenario. Okay, you all have to work it out now. I'm going to speak less.
HCO3 alkalosis.
And what about others? Please use the chat box. Okay, now since you all have already become masters, now I'll make you a real expert. Real expert is you are knowing your diagnosis. Now, my next question. Next, please use the chat box. Okay, Azad has written respiratory alkalosis. Everyone, please use the chat box. Do you know what is the formula to say if it is acute or chronic? I'm going to teach you that as well. Now, I'm going to take you even beyond your consultant. Consultants will be saying, oh my gosh, this guy is able to tell about whether it is acute or chronic. So I'm going to teach you that as well. So I think you already went through the pH. So pH is lower or higher? pH is higher, yes. So this is acidosis or alkalosis? Alkalosis. Okay. So, and then PCO2 is normal or higher? So, how much is the normal value? Oh my gosh.
35 to 45.
Yes, exactly. So, PCO2 is lower or higher?
Lower.
Everyone agrees? Wonderful. And the PO2 over here?
Lower.
Right. So, what do you think so far now? So, this is alkalosis for sure, by looking at the pH. And by looking at the PCO2? Wonderful. You all are so smart. Okay. Now, the next level of question. So, you have all these values. Yeah. So, you already know now the answer for this. Now, the next question I'm going to put is whether it is acute or chronic. How are you going to calculate? So, this is the formula. This is the formula if you want to use. So, for example, what happens is if it is acute, the pH change will be 0.08 times into 40 minus PCO2 divided by 10. I would really like you all to know this formula because this formula is really, really important. So, in this, if you are going to put up the value of PCO2, blah, 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 for a pH of 7.49, yeah, So how much it is coming? And yes, if it will be 0.09, otherwise if it is going to be chronic, then 0.03 into this, okay? You should be doing it like this. So then you get a pH of 7.43 or 7.49. But we already can see the pH. So what is the pH is 7.48.
48. So it
So
is acute.
absolutely, you all are the masters. You all are so smart. Okay? So if you have just three values, you will be able to know whether it is acute or chronic as well. Don't forget this formula: 0.08 for the acute, 0.03 if it will be chronic. 40 minus PCO2 divided by 10. And you calculate the pH with this, and as you calculate the pH, you will be able to see it is acute or chronic. Yes? Okay, one more example. So what do we notice in this, the pH? Acido.
It is alkalos.
Oh my gosh, everyone is now so smart now. And the PCO2?
Is it decrease?
Wonderful, wonderful. And O2?
That is also on lower side.
Wonderful. So this is,
Respiratory alkalosis.
and what is the reason for that is? The reason is hypoxia. Okay, so now since we have finished one example, let's try to go to the second example. A 47,
pH is normal.
yes, first read the history as well, my friend. What did I say to you? There are few things you can do without the ABG as well. So history is also, you are a doctor. You're going to be a cardiologist. So you should be able to understand, first of all, what is the importance of history. History is very, very important. Yeah? So let's try to be clinicians. So 47-year-old woman with a history of 65 pack per year tobacco use is being evaluated for disability due to dyspnea. She comes to the ER, you are there, okay, and you see this patient. You did a ABG, and this is what you obtained. So pH is 7.36. So is it normal, abnormal?
This is normal, but we can evaluate as a COPD patient.
Okay, okay. I can see there are two people trying to speak. Okay, pH is normal. Then what about the PCO2? Okay, I'm already getting some answers as well. So PCO2 is 54, right? And the PO2 is 62 over here. So let's try to be, first of all, very smart guys. Let's try to see whether it is acute or chronic. I'm already getting some smart people answers as well. Conflicting answers. Okay, let's try to find it out in the meantime. So what is the gradient difference? So gradient difference, I had already shown you the formula last time. So in that is for the acute and for the chronic. So, with the 0.08 and with the 0.03, what is the pH you get is? So the pH, as we could already see, 7.36. So this is definitely a chronic case, yeah? So we are able, yes. So now, yes, so we were already having the other values as well. So this is definitely a chronic but respiratory acidosis. Acidosis, why did we say it? Now you have to tell me. Tell. So what has happened is, since this is a chronic case.
So it is towards the acidotic side, pH.
Yes, yes. And what has happened is, due to the compensation has also happened, in fact, in this. Okay, so that is why chronic respiratory acidosis, and both are hypoventilatory and primary oxygenation abnormality, in fact. Okay, since you have understood this, I'll try to give you a little bit different style of question. Let's do one more example. Okay, Says there's a patient of 32-year-old, 32-year male, okay, to the nursing unit with a severe asthma attack. And the patient, हाँ जी बाकी है, please आप mute your microphone, please. And the patient has been experiencing increasing shortness of breath since admission, which was 3 hours ago. You, uncle ji, auntie ji, please mute your microphone. And then you did the ABG. So you got it now? So what do you notice in this lab picture? 7 point. Vikas Singh, please. Vikas Singh, please mute your microphone. Who is it? Please mute your microphone. Don't disturb others during the lecture. Hmm. So,
It is acidosis.
mhm.
Respiratory acidosis.
Hmm. What about the first?
ACO2 is increased.
Okay. So what about the? So we all remember. Hmm. We saw that pH is low, so therefore it is acidosis. We saw the CO2, it is high, right?
Yes.
So it is high, of course, but in the opposite direction. So then we try to see for the bicarb. Bicarb, when we notice it, it is in the normal range, right? And
Yes.
acidosis is present because of the decreased pH with PaCO2 being increased. So what it reflects is primary respiratory problem. And for this patient, in fact, we need to improve the ventilation status by providing oxygen therapy or even mechanical ventilation. If you want, you can even give some bronchodilators, okay? Because as I said it, you are a doctor as well, so you have to treat the cause. You're not just technician, like you just have to yeah, just diagnose. No, you should be able to treat the patient, help that patient's quality as well, right? Hmm. So one more example. Let's make you the real masters. So there's a 35-year-old female patient admitted with recurrent bowel obstruction, and the patient is having intractable vomiting. So there's some hint already in the last several hours. So you did ECG, and then what is the so this is what you notice. So now you have to.
It is metabolic alkalosis.
Oh my gosh, my audience, my kids have become really, really smart now. Hmm? Very, very nice. Okay, is it now? Okay, let me give you the twist. Is it acute or chronic? Anyone else?
No, it's chronic because according to history is recurring bowel obstruction and vomiting from last several hours.
Calculate the pH. It is simple. Use your pen and papers. Let's see others.
That can be acute.
So, come on, you know this is not you don't have to guess. You have to do the calculation and you will know the answer. Isn't it? So, so you all can, and now it's not such a difficult and complicated thing as well. You all can sit together. I mean, take your time and and do it. Yeah. So we saw at the pH, and pH is of course higher, so it is alkalosis. You saw at the CO2, it is in normal range, but the bicarbonate is high. So this is metabolic.
Alkalosis.
Yes, exactly. And what are you going to treat it with? Treatment, I think we can talk more in details, but on an overall basis, you have to try to treat for the excess space. And the thing, as I had already said, it is, yeah, being in the wards or in the exams as well, one of the key things is practice, practice, practice. There are some softwares as well, which is there in your apps or mobiles. You can use it in a smart way. And one of the important things is you should try to always think as well. What about, why the patient is not breathing well, and is there some dual pathology, like is there respiratory, metabolic disease as well, both of them together, in fact. So there's already a algorithm from ARC, Australian Resuscitation Council. So the five-step approach, what it says is, uh, you have to do is there's a five-step approach. So for example, the first one is of course, how is the patient? So how is the patient? That's why we all are clinicians, healthcare professionals. So it is going to give you a clue for the interpretation of the results, in fact. And then you try to assess for the oxygenation. Is the patient hypoxemic? If the PaO2 should be more than 75 mm of mercury breathing air, similarly, then you have to do some bedside calculation in the sense like the percentage of inspired concentration multiplied by 5 times. It should be at least within 75 millimeters of mercury. Then comes is the pH, acidic, alkalic. Then comes the respiratory component. On the basis of this, whether it is respiratory acidosis, alkalosis. Then, uh, as we spoke about, is the metabolic component. If it is less than 22 or more than 26 or 28, for so so to summarize, how is the patient? You have to see for the oxygenation, then the pH, respiratory, or the metabolic component. So I'll give you one more example. Practice makes a doctor, I would say, more perfect, right? So you are called up by the staff. There's one 21-year-old woman which is on the way, is becoming drowsy, in fact. The lady was thrown off her horse at a local event. So, so what are the things that should be done is A, B, C, D, E. So the uh, clearing was done to tolerate, and the patient is able to tolerate a oropharyngeal mask. So 40% of oxygen is being given. Then respiratory rate is like 8 beats per minute, in fact. You try to see the SpO2 is like almost 99%. Good air entry, both sides. Pulse is 54 beats per minute. Blood pressure is pretty good, but slightly on the higher side. ABG was done. Okay. Check the blood glucose level as well. Normal. IV in the right arm has been put up. In fact, the eyes are slightly swollen. Bruising is present. And now the doctor is being called. So this is a specialist protocol. If you will be practicing medicine, and especially in the ER, this is how you have to put up everything. So practicing in Australia is not easy, okay? So a lot of people I know, you all would like to go and be there, in fact, in future. So you have to follow more and more protocols, especially in any of these Western countries. So this is a typical example in Australia. That's why this is an example from ARC. Hmm. So the first of the five steps in ABG is, as we already said it, how is the patient? You have to do the ABCD examination, assessment, in fact, for the patient. So we already spoke about the ABCD examination, huh? Over here, as you can see, ABCD is what? Airway, breathing, circulation, D for
Circulation.
and E for axis. A, B, C, D, E. And don't forget that airway, breathing, circulation, glucose, drugs, drugs actually, E for axis. Okay, you did the ABG. Oh, the answers are already here. So, but try to think logically. What is happening over here? So you got the values over here. So the pH is on the lower.
Acidic side, yes.
Right, right. Acidic side. Then after that, what do you see after pH?
PCO2 is a higher side.
Increase, higher side.
Wonderful. PCO2 is like more than 78, in fact. 78. So 35 to 45, that's what I was knowing was normal. And similarly, oxygen is also on the higher side. However, when we look at the bicarbonate is within normal. Now the trick comes. So, what is it?
Respiratory acidosis.
Good. Good. So you all are already now the masters. So now I need not teach anymore. You all are very well knowing, in fact. And yes, because the other thing was acute or chronic, right? You all did not calculate it. You all are forgetting it. Don't forget, acute or chronic as well, you should be able to say. Because if it is chronic, for example, like CO